I'm Professor Jin Marley and I'm the Medical Director of the Mood Disorders Unit at Ramsay Clinic. And today I'm going to be talking to you about bipolar disorders. So in terms of defining the illness more specifically, we've been focused very much on mood, and that translates to people describing their feelings, their emotions, their day-to-day changes in mood. But in fact, there are other aspects which are really important. So activity and energy, that change, is equally important. And the other aspect that often gets overlooked is thinking. People's cognitions, what we call cognitions, but people will say, my memory's not very good, or I'm not able to attend or concentrate. And that really impacts functioning. So there's those three domains, which are much broader than just a mood. So it's energy alongside mood, alongside cognition. So the diagnosis of bipolar disorder is actually quite complex, and it's an ongoing process, and I think that's what people need to bear in mind, that there isn't a particular point in time where you acquire the diagnosis. In my view, it constantly needs to be reviewed, checked up, and if necessary, revised. Now, the earliest way of detecting the illness, there are certain symptoms which are key, and you can have a checklist and perhaps you meet the criteria. But then you really need to see a doctor. And that might be your general practitioner in the first instance, who then may refer you onto a specialist, such as a psychiatrist. And it's that longitudinal perspective, the history taking, the understanding of what factors are possibly playing a role in your current presentation that really firms up the diagnosis. But even once a diagnosis has been made, it constantly needs to be checked and reviewed because it may still evolve. And there's a very strong link between depression and bipolar disorder. And in many ways, the same should be taking place when we diagnose people with depression, constantly reviewing them for the possibility of emerging or developing bipolar disorder. So I often get asked, why is bipolar disorder difficult to manage? And the reason is we have two components to the illness. We have acute episodes of depression, acute episodes of mania. Sometimes those can require hospital admissions and careful treatment for long periods of time. But there's the other component, and that's really more important in my mind, which is the maintenance treatment, the prevention of further episodes. And that's why the actual management of bipolar disorder is quite complicated, because sometimes we need different approaches and different treatments for each of those phases. So the treatments that could work, let's say when you're extremely depressed or extremely manic, they may be useful for a few days or a few weeks, but they're not the treatments that you're going to be prescribed long term. A whole different suite and set of treatments are required when we're looking at management in terms of long-term maintenance and prophylaxis. And that's a different game, as it were, in terms of trying to maintain wellness and improve optimal functioning. That's what makes it complicated, that you've got to constantly be revising the treatment and reviewing where you're at. Currently, in terms of the armamentarium we have to treat bipolar disorder, we have a broad scope. We have psychological treatments, which are probably underutilized. We also have pharmacotherapy, which sometimes is overutilized. And we also have physical treatments. And this is an exciting area. Alongside ECT, we have newer treatments emerging, which we're still appraising the efficacy of, but certainly we have more and more options, for example, TMS. So we can use combination of these strategies very broadly. So you could have someone who's having psychological treatments from one particular practitioner or as part of a group. They're also getting medication from their doctor, and at the same time, they may be having other forms of physical treatment from time to time. So the broad range and the kind of options we have is quite excellent. The problem we have is tailoring treatments to the individual. There's still not enough known about the biology or indeed the treatments to be able to predict whether a specific treatment in a particular individual will work and what will be most effective. And that's the biggest challenge we have at the moment.